what will be the approach for this extraction? Unlike mesioangular impaction, we cannot create a purchase point on the mesial half and simply lift this tooth up. Since the tooth is horizontally impacted, we have to section this tooth. So we reflect full thickness periostal flap in this region. So after the flap is reflected, we section the tooth. The first section will pass somewhere around here. So we will always cut the tooth from the buccal side and not from the lingual side, because we do not want to injure the lingual nerve. So after we cut the tooth in the buccal aspect, we use the straight elevator and we split the tooth into half. So when I tried to lift this part after sectioning it, the problem what I encountered was this tooth was placed more on the buccal side and was slightly anterior to the distal part of the mandibular second molar, meaning that I could not rotate this tooth all the way up using straight elevator alone. So what I did was I slightly lifted the tooth somewhere around here, and then I sectioned this part as well. And after this section was removed, I could easily lift up the remaining coronal part of the tooth. So, and then the coronal part was removed. For the radicular part, since in this radiograph we can see the tooth are almost fused. So what I did here, instead of splitting the root into half, was I created a purchase point somewhere around here, and using Krayer's elevators, I engaged the purchase point and then I tried to move the root in the mesial direction. So what it did was it pulled the entire root in the mesial direction, and then I was able to remove the tooth easily. So this is the small part that I had to remove before I could remove the entire crown, and then the remaining part of the crown was removed, and in the third step the entire root was removed.